At the inaugural session of this myeloma workshop, we had the opportunity to hear from various groups regarding the research they're doing to understand at what point does a B cell becomes a myeloma cell. And currently, the current paradigm is that this really starts at the germinal center when the plasma cells become plasma cells. And now this is being challenged because there are some thoughts that perhaps there are some instances where there may be earlier components to the clone. I personally remain somewhat skeptical, but I really applaud the investigators because one of their arguments is that if we are to get to the cure for most myeloma patients, we really need to understand where it starts. So we saw analysis with, clone assays and FISH and other genetic markers to see if we can identify earlier progenitors. So I think it was a fascinating conversation, very interesting. We also saw some work from the group of Dr. Mora at the University of Miami, where they're trying to elucidate, what leads to some of the genetic changes that result in the hyperdiploid variant myeloma. We know almost nothing about hyperdiploid. All we know is that about half of myeloma patients have extra chromosomes, and that is really what's we think leading to the pathogenesis. But exactly how, it's completely unknown. So it was just a great conversation we had regarding the cell of origin for myeloma, and I hope in future years we actually have further clarity of where it actually starts.